Hello class. Today we're going to go over renal system drugs, or chapter 11. There's some chapter topics we want to cover, such as function of the renal system, acute kidney injury and chronic kidney disease, urinary tract diseases and disorders, diuretics, and complementary and alternative therapies. Our learning objectives are to understand the renal system, its importance, and how it works, to differentiate the parts of the renal system, to describe the drugs used to treat renal disease, to state the cause and treatment of urinary tract infections, and explain the classes of diuretics and how they work. The function of the renal system. So there's the kidneys that maintain the balance of water, electrolytes, and acid and bases in the extracellular fluids. Forms urine, which enables the blood to reabsorb necessary nutrients, water, and electrolytes. There's regulation functions of the kidneys include plasma volume, concentration of waste products in the blood, plasma electrolyte concentrations, and acid-base balance of plasma. So here we have a diagram of the renal system. Things are labeled here. This is much easier to view in your textbook, and it goes into a little bit more depth. This is a lot of information to cover where you might skim over just a little bit of it, but you can always refer back to your textbook. I just don't want your lecture to be hours long. So here we have a kidney. The renal artery brings blood into the kidneys. The renal vein returns blood to the bloodstream. And the renal cortex and medulla perform filtration. They're made up of nephrons and the functioning filtering units of the kidney. They're all labeled here. The kidneys are responsible for filtration, the removal of substances from the blood, for reabsorption, the pulling back of substances into the blood, and secretion, the release of substances into urine. Acute renal failure is a rapid reduction of kidney function resulting in accumulation of nitrogen and other waste. It's caused by renal ischemia, trauma, pregnancy, volume depletion, hemorrhage, or surgery or shock. Uremia is a clinical syndrome resulting from renal dysfunction. It's marked by nausea, vomiting, vertigo, convulsions, and coma. Different parts of the renal system here. The ureters are paired muscular ducts that move urine from the kidney to the bladder. The urinary bladder collects and holds urine until it exits during urination. It can hold up to 1 liter of fluid, and only 300 to 400 mils are held before voluntary voiding occurs. Ureters and urinary bladder. This labels the functions here. The distended bladder, stretch receptors sense pressure, detrusor muscles contract, external urinary sphincter relaxes, urine is pushed out, and the bladder empties. Micturition is the process of emptying the bladder. Urinary retention is the kidneys produce urine, but the micturition process does not function properly and urine accumulates in the bladder. Incontinence is the ability to control the external urinary sphincter and urine leaks out of the bladder. Assessing kidney function. The blood urea nitrogen, or BUN, and serum creatinine levels they decrease elimination and increase blood concentrations when kidney function is impaired. Good markers for kidney function. A creatinine normal range is 0.5 to 1.5 milligrams, and it's used to calculate creatinine clearance. Creatinine clearance is an estimate of glomerular filtration rate. On page 415 of your text, it goes into a little more depth about assessing the kidney function in the Cockcroft and Gault equation. What do the kidneys regulate? Plasma volume, concentration of waste products in the blood, plasma electrolyte concentrations, and acid-base balance of plasma. There's different types of renal disease. One is acute kidney injury, and then chronic kidney disease. Acute kidney injury is limited and short-term during drug therapy. CKD is drug therapy for reestablishing fluid volume and treating underlying problems, hypertension management for preventing progression, and dialysis in advanced stages. Kidney disease treatments. Hemodialysis. I'm sure you've probably seen dialysis clinics around town. This is where people who have chronic kidney disease go to be treated. So it's just a continuous cycle of blood diverted to machine, blood filtered by machine, and then blood returned to the body. There's peritoneal dialysis, which is dialysate fluid placed in abdominal cavity. Toxins and electrolytes diffuse into dialysate fluid, and dialysate fluid is drained and changed. All of these are a very brutal process to have to endure. Therapies for anemia. Anemia is a condition characterized by deficiency of red blood cells or hemoglobin, and due to reduced erythropoietin, a hormone secreted by the kidneys. Erythropoietin stimulating agents used in CKD to stimulate red blood cell production, and side effects include hypertension, seizures, increased risk of blood clots, and allergic reactions. Epopoietin alpha or Procrit and then darbepoietin alpha, Aranesp, are often used. They're usually given 3 times weekly or once a week to every 2 weeks. There's different dialysis therapies. Sensipar lowers parathyroid hormone, calcium, and phosphate. It's used to treat secondary hyperparathyroidism in CKD patients undergoing dialysis, and it can be given alone or in combination with vitamin D. Renvela limits absorption of phosphate in the intestine and lowers phosphate without altering calcium, aluminum, or bicarbonate. It can interfere with absorption of other drugs, though. There's different supplemental therapies. Ergocalciferol is a vitamin D supplement. It's not routinely given until patients begin dialysis. And folic acid, vitamin B9, is required for the formation of erythrocytes. It can be given to renal patients daily in the form of nephrocaps. It's different medications that are supplemental therapies there. The book goes into a little bit more depth covering those medications and how they work. There's some more supplemental therapies, levocarnitine, different vitamins. Kidney transplant therapy. The length of the surgery is around 3 hours. You have to stay post-op for several days in the hospital. Recovery time is around 6 months. The maintenance immunosuppression required to prevent organ rejection, and the close follow-up required for many years. So kidney transplant therapy, the immunosuppressant medications such as cyclosporine. The role in the therapy is immunosuppressant used to prevent organ rejection. There's more about the cyclosporine. The oral liquid formula of cyclosporine should not be consumed out of plastic or styrofoam cups. Cyclosporine binds to plastic, and using a plastic container may result in receiving a smaller dose than intended. There's also tacrolimus. That one is used as an injection a lot. I think Prograf is also available in a capsule. but we use that a lot in the hospital. There's some just different medications regarding the kidney transplant therapy. Mycophenolate are similar. So it says mycophenolate, mofetil, and mycophenolate acid are similar drugs. However, they are not the same, nor are they interchangeable. Double check prescriptions for either of these drugs and make sure patients receive the correct one. List 2 drugs used for anemia of chronic kidney disease. Epoetin and darbepoetin. Urinary incontinence is defined as the involuntary loss of urine. There's different types of incontinence, urge or overactive bladder, and overflow incontinence, where you don't have the urge, it just, you can't control your urine release. Symptoms is urgency, frequency, incontinence, and pain. There's different drugs to treat urinary incontinence that are listed here. There's some more. Urinary tract infections, or UTIs, occur when bacteria enter the opening of the urethra and multiply. They usually begin in the lower tract and, if not treated, progress to the upper tract. Diagnostic criteria include the presence of bacteria and symptoms. And there's different types of UTIs. One is cystitis, prostatitis, and an upper UTI. There's different antibiotics that can be used to treat UTIs. Amoxil, Augmentin, ampicillin, Cipro, Cystex. They're all commonly used to treat UTIs. There's some more. Bactrim, Macrobid, Pyridium. Pyridium is the urinary analgesic. Benign prostatic hyperplasia, or BPH, is the abnormal enlargement of the prostate gland. Becomes a problem when it obstructs urine outflow from the bladder. This is very common in men as they age. There's different treatments for BPH. One is alpha blockers. How they work is they inhibit the alpha-1 receptors in the prostate gland and bladder. This relaxes the muscle, thereby reducing urinary resistance and improving urine flow. Some examples of alpha blockers, Uroxetrol, Cardura, Minipress, Flomax is probably one of the most common ones you'll see, and Hytrin. 5-alpha reductase inhibitors. The way they work is they inhibit the conversion of testosterone into its active form, DHT. The resulting effect is reduced prostate size. These include Avodart and Propecia. Diuretics are a substance which increases the volume of urine output. They're used to improve urine output, reduce blood volume, treat edema, and enhance effectiveness of other drugs. Classes of diuretics, the carbonic anhydrase inhibitors such as Diamox. Loop diuretics, ones that you'll see most often are furosemide. The way they work is inhibit reabsorption of sodium, chloride, and water in the ascending loop of the hinel. This produces a fast and profound diuresis. Furosemide, as I mentioned, Lasix there, Demodex, Bumex. These are all very common diuretics that you'll probably see. Potassium-sparing diuretics. So the loop diuretics are potassium depleting, so if you're on Bumex or furosemide, you'll probably have to have a potassium supplement regimen as well. But there's a different class called potassium-sparing diuretics, and they block the exchange of potassium for sodium in the distal tubule. And they don't deplete potassium from the body. These include aldactone, Mitomor, Inspra, and Direnium. Thiazide and thiazide-related diuretics. They promote sodium and water excretion in the urine. They lower the sodium level in the blood and reduce vasoconstriction. The increased sodium in the urine is exchanged for potassium, resulting in potassium loss. So these are also potassium depleting. Those are your ones listed there. The chlorthalidone hydrochlorothiazide, or HCTZ, which is a very common diuretic that you'll see in retail. Chlorothiazide, indapamide, and metolazone. What are the main types of diuretics discussed in this chapter? Carbonic anhydrase inhibitors, loop diuretics, potassium-sparing diuretics, and thiazide diuretics. Complementary and alternative therapies. This saw palmetto. It's used to treat BPH symptoms. It's shown in clinical studies to have similar efficacy to finasteride for symptom reduction. Reduces the thickness of prostate gland's inner layer. Some side effects can include dizziness, headache, nausea, vomiting, constipation, and diarrhea. And it will also interact with some other anticoagulants and some hormone therapies. Cranberry juice is used to prevent the recurrent UTIs. It's shown in clinical studies to be effective in preventing UTIs in elderly women, pregnant women, and in patients. This is actually available over the counter in a tablet as well, the effects of cranberry juice in Azo Cranberry. It's in a pill form. It's thought to work by adhering to bacterial cells and preventing them from attaching to the inner walls of the bladder. Side effects can include upset stomach and diarrhea when consumed in large amounts, and it can interact with warfarin. It's also not good if you are a diabetic, because cranberry juice is incredibly high in sugar. So if you are a diabetic who has UTIs frequently, I would definitely consult a physician before trying to self-medicate with cranberry juice. All right, we're at the end of the chapter. The chapter summary is the main function of the kidneys is to maintain the balance of water, electrolytes, and acids and bases in the body. Creatinine clearance is often used to assess renal function. Dialysis can be a life-saving intervention for patients with kidney disease. Urinary incontinence often affects older adults. BPH commonly affects older men. And the primary action of diuretics is to rid the body of excess fluid and electrolytes. I know that was a lot of information. If you all have any questions or want to go over this some more, just reach out to me. You can email me or give me a call, either one. Just let me know if y'all need anything.